Autologous bone grafting is the gold standard in Japan, but new bone defects occur in the ilium and fibula, which are bone harvesting sites. In addition, the operation time will be longer, and the patient's surgical injury will increase in two places, such as pain due to surgery at the bone harvesting site. Allograft DBM is human bone from a bone bank, and in Europe and the United States, the distribution of transplanted bone is balanced and functioning. But other regional countries are not functioning and have insufficient supply to meet demand. There are still infectious diseases and ethical issues. Xenogenic bones are bone grafts harvested from animals' bovines and are widely used in oral surgery. However, compared to Next21's tetrabone, this xenograft has inferior integration and remodeling data in comparative bone replacement trials. Autogenous bone, allograft and xenograft bone grafts have their own characteristics and drawbacks. Next21 has commercialized two types of artificial bone manufacturing methods, 3D printing and injection molding. This establishment has enabled more effective and safer bone grafting with less burden on patients. The main component, OCP, is an intermediate in bone metabolism and is excellent for osteogenesis and remodeling. CT bone is a custom-made bone graft fabricated by a 3D printer from the patient's CT DICOM data. Shim bone can be mass-produced by injection molding technology, and it is possible to systematically manufacture bones of almost any shape as a bone bank. The starting material for both shim bone and CT bone is alpha TCP. Shim bone is shaped by a ceramic injection mold, that is, injection molding. CT bone uses an inkjet 3D printer to apply the powder lamination method. After shaping, it is recrystallized in an acidic solution of succinic acid to form calcium-deficient hydroxyapatite containing OCP. Unlike conventional high-temperature sintered stoichiometric hydroxyapatite and beta-TCP, this new artificial bone has the characteristic of remodeling to own bone. High-temperature sintered stoichiometric hydroxyapatite HA and CT bones molded with a 3D printer were implanted in the target positions of the dog skull, and bone penetration and bone regeneration into each artificial bone were observed. The size is 15 mm by 15 mm square, and the CT bone has 3 communicating holes that intersect each other at right angles to guide bone marrow and speed up bone regeneration. In comparison of bone union, with hydroxyapatite HA, bonding is insufficient even after 24 weeks. But with CT bone, the boundary between the mother bone and the artificial bone disappears, and early bone union is observed. Fibroblasts and bone marrow invasion were not observed in HA, but in CT bone, fibroblast invasion was observed at 4 weeks. And at 24 weeks, bone marrow was formed in the same manner as mother bone. Hand, it is observed that the same ossification as mother bone is progressing. We measured the X-ray absorption intensity Hounsfield units in each structure of the HA bone graft and CT bone over time to observe changes in the bone graft. The HU value of the HA artificial bone does not change much, and it is an inactive bone graft with little penetration into the bone. In CT bone, fibroblasts and bone marrow enter the communicating pores in about 2 weeks. In addition, the bone penetration into the artificial bone is about twice that of HA. This means that CT bone accelerates bone replacement and at the same time increases the strength of the entire artificial bone graft. Socket preservation minimizes bone resorption after tooth extraction by placing artificial bone or autogenous bone in the tooth extraction socket, the hole in which the tooth was extracted, making it possible to proceed with implant treatment in an advantageous manner. It also minimizes bone augmentation when placing implants. In the sinus lift, it is necessary to create a lot of bone, so an incision is made on the side of the gums of the upper jaw, the bone surface is exposed. The mucous membrane of the maxillary sinus is peeled off and lifted, and materials such as artificial bone are placed in the created space. After that, the wound will be closed, and we will wait several months for the bone to form. In a treatment called GBR-guided bone regeneration, bone is regenerated by inserting your own bone or artificial bone material into the part where bone is missing and covering it with a special membrane. At Next21, we also manufacture membrane-like titanium mesh plates, ultraflex mesh plates that are suitable for clinical use of GBR and are capable of three-dimensional deformation. This is a comparison of bone regeneration from a blood clot without inserting anything into the tooth extraction socket. Inserting beta-TCP granular artificial bone, and inserting tetrapod-shaped artificial bone made of OCP. Bone regeneration from the negative control clot was low, and significant bone resorption around the extraction socket would be expected. In the case of beta-TCP granules, bone regeneration can be performed in the deep part of the tooth extraction socket and it is rough. But it is observed that bone regeneration is insufficient in the surface part due to beta-TCP elution. In the case of tetrabone, vigorous bone regeneration was observed in the entire tooth extraction socket, and in particular, bone regeneration was achieved on the same plane as the alveolar bone on the surface. Minimal bone resorption. This phenomenon is due to the synergistic effect of the osteoconductive ability of the ideal size of the tetrabone throughholes and the high osteoinductive ability of the OCP. This is a comparison test of inserting beta-TCP granular artificial bone and tetrabone by punching through holes in rabbit femurs. As can be seen from the pathological section images, tetrabone is observed to promote more uniform bone regeneration overall. Many dead spaces are seen in beta-TCP, but almost none are seen in tetrabones. It is influenced by the formation of ideal external communication holes. The production of new bone is 37% higher in tetrabone, and the reason is the synergistic effect of the osteoconductivity of the tetra-shaped throughholes and the osteoinduction capability of the OCP. Importantly, the strength of tetrabone after implanting artificial bone is more than twice that of beta-TCP, and it is more reliable when implants are implanted after bone regeneration. Can be fixed strongly. In the case of implanting the artificial bone material into the hole of the femur of a rabbit, the same phenomenon as in the comparison test of tooth extraction sockets was observed from pathological section images. Beta-TCP shows soft tissue penetration where it is absorbed. The part where this soft tissue has entered does not change to bone tissue. In the case of necrosis, the inflammatory reaction from the necrotic tissue causes defects including the surrounding bone tissue. With tetrabone, bone is regenerated at the level of throughholes in the mother bone, and there is no invasion of soft tissue. In addition, the regenerated bone around the tetrabone is similar to the mother bone tissue regeneration is observed. Tetrabone filled the defect sufficiently and maintained the bone shape of the implanted site 8 weeks after implantation. Beta-TCP granules were resorbed 8 weeks after implantation and had already disappeared at the center of the defect. In tetrabone, the ridge length of each particle is 1 mm. Beta-TCP granules are almost the same size, 0.5 to 1.5 mm. Negative controls are empty throughholes, and positive controls are normal bone without drilling. All dogs were euthanized 8 weeks after transplantation and the left femoral condyle was excised. A micro-CT scan was performed. Elastic moduli were calculated from the load/displacement curves. A comparative study was performed at 4 weeks after transplantation in vitro and vivo. Examination in vivo is considered to be close to actual human clinical evaluation. The strength of beta-TCP granules was about 10% lower than that of the positive control, but it recovered to 50% with tetrabone. Regeneration of mechanical strength in bone defects is also a clinically important factor. Tetrabone was able to acquire 5 times the strength of beta-TCP in 4 weeks. Reducing the depth and duration of the mechanical strength trough after a bone defect shortens the patient's recovery time and prevents refractures. A comparative study was conducted between tetrabone and DB bovine-derived deproteinized bone at the University of Gothenburg, Sweden. Compared to DBB, the intergranular spaces of the tetrabone group appear to be filled with large amounts of lightly stained mineralized new bone. Images show selected areas of each artificial bone graft site 14 days post-implantation. White arrowheads refer to the interface between the particle surface and the formed bone. OC indicates osteocyte lacunae. It can be observed that tetrabone has better bone remodeling ability than DBB. Current gene expression, morphological and ultrastructural data have shown that bovine substitute DBB is osteoconductive and has low resorptive activity. Furthermore, the synthetic substitute, tetrabone, induces early osteogenic and osteoclast activity, resulting in more bone formation compared to the natural substitute DBB. Synthesis of OCP is the world's first crystal synthesized by Professor Monma more than 30 years ago. Tohoku University has been researching this OCP for many years and has developed a scaffold that combines OCP and collagen fibers. A scaffold with a shape using OCP crystals as a bone graft material was difficult to manufacture and was never commercialized. At Next21, we have established the world's first manufacturing method for OCP artificial bone scaffolds through custom molding using a 3D printer and mass production using injection molding. After molding alpha-TCP with an arbitrary shape and internal structure, it is transformed into OCP by recrystallization in a weakly acidic dicarboxylic acid aqueous solution. The feature of OCP artificial bone is that it is a physiologically active substance, unlike other materials such as HA and beta-TCP. It has recently been published in a paper that this osteoinduction, OCP angiogenesis, and chondrogenesis effects will be very advantageous for bone regeneration after 2020. Furthermore, OCP is the ultimate regenerative medicine material that induces differentiation of bone marrow stem cells (MSCs) and proliferates chondrocyte and osteocytes. There are many manufacturers of synthetic bone graft for transplantation around the world. Hydroxyapatite HA and beta-TCP have historically been the mainstream, with intermediate components between the two and mixtures of HA with other materials. The market is expected to expand steadily. Next21 uses OCP, currently the best bone substitute, to create shapes desired by patients and doctors using 3D printers and injection molding. We are the only company in the world that can manufacture 3D designed bone scaffolds. We also have 5 independent regenerative medicine innovation technologies. By combining these, we provide bone regeneration procedure with high patient satisfaction, minimum invasive, and short healing time due to high bone remodeling. Furthermore, by linking these technologies with DX digital transformation and AI artificial intelligence, it is possible to build the best bone reconstruction algorithm for each specific patient.